The possible side effects found in the AstraZeneca vaccine, in the opinion of Health Secretary Dr. Osbourne Liko, is only a minor issue compared to the benefits of the vaccine.
Benefits of the vaccines now outweighs the risks. Furthermore, in clinical trials, the number of thrombotic events were lower in the vaccinated group as compared to placebo group. So, to conclude, in terms of the quality, there are also no confirmed issues related to any batch of the AstraZeneca vaccine used across Europe or the rest of the world.
A number of national medical doctors backing the vaccine up.
The way forward for all of us is to get this vaccine here as soon as possible. This is an excellent vaccine, there's no question about it. And it comes under the COVAX, under WHO. Everybody needs to know that the vaccine is safe.
You know that vaccination or immunization is a prevention method. And so our doctors, we will encourage vaccination because they are frontline workers, so as the other healthcare workers, nurses and allied health workers. So for NDA's point of view, we support the call made by the government, which was recommended by MESAC and all our developmental partners.
Malawi said it's their choice, but they have to understand that if they get infected, they may infect other people, and those other people might be their grandmother or their grandfather, and those people may die as a result of the infection, which they have given them because they haven't been vaccinated.
Several European countries have blocked the vaccine after they found some citizens having side effects of blood clots after receiving the vaccine. Meanwhile, countries like France, Italy, Spain and Portugal have resumed vaccinations after the European Medicine Agency on Thursday said new experts' analysis concluded that the benefits of using the vaccine outweigh the risks.
Time in country as we all together experience the surges in cases, the ongoing transmission, which is intensifying not just here in the National Capital District, but right across the country. We're seeing an increase in healthcare worker infections, and these infections have an impact already on our small number of health workers across the country. This makes it very difficult for our hospitals and health facilities to maintain essential services, as well as continue to provide care for COVID-19 cases.
This week, Australia announced 8,000 AstraZeneca vaccine from its own national stock would be given to PNG, and also committed to purchasing a further 1 million vaccines.
1 million doses of our contracted supplies of AstraZeneca, not for Australia, but for PNG, a developing country in desperate need of these vaccines. We've contracted them, we've paid for them, and we want to see those vaccines come here so we can support our nearest neighbour PNG deal with their urgent needs in our region. And we'll be seeking the support of the European Union and AstraZeneca to achieve that as soon as possible.
Dr. Matthias Sapuri, who is the West New Britain Provincial Health Authority CEO and also a senior doctor at the Pacific International Hospital, stating that the risk was there for the elderly and the frontline health workers.
To spread to all the other provinces quite rapidly. And that's what I'm from your advice, that's what we are seeing. So it's going to be a big challenge for us in the country, and the Secretary has already pointed out and spelled out what the challenge is going to be for us into the future, or the rest of this year and probably more, that things are going to get more worse than we think. So I'd like to make this call to the rest of my colleagues of the PHAs throughout the country, that they must take responsibility very quickly and not just leave all these operational matters to the provincial coordinating committees or the provincial COVID committees. Because if they do, then you'll find a lot of things that may be slow, and then problems start to arise.
In mid-April, the first lot of vaccines are expected to arrive, and the frontline workers in hospitals and clinics in NCD will be the first to receive it. Annette Cora, National EMTV News.